Well, I'd like to start by thanking everyone for coming tonight. I know that it's kind of late in the day, and I know at least in St. Louis it's probably happy hour time. And then, of course, there's a Bernie event downstairs, so this is a great choice that you made to come spend some time with us here today. The story we'd like to share with you is that what we call an integrated art delivery, a patient-focused approach. And it's really a case study of the work that we did with Blessing Hospital on the addition of the Moorman Pavilion. And with this approach, we set goals to enhance the patient experience, improve wayfinding, and involve the community, and do this centered around the inclusion of art in the project. The first thing I'd like to do is sort of give you some context. I'm going to turn it over to Jayne for a little bit here to give you some context of where Quincy is and the health system itself. So,
thanks, Robin. Like she said, my name is Jayne Huseman, and I'm the construction project manager with the Blessing Health System. I have a unique story to share that I was born and raised in Quincy, as well as working in the Chicago market, and had an opportunity to come back to Quincy to do some construction project management. Unique in facilities. I was actually born in this hospital. So it's interesting as we tell a story here about Blessing and the artwork. It's a very local experience. So I just want to share that also from my perspective. Quincy, Illinois is about 5 hours located from Chicago, about 2 hours from St. Louis. We're on the banks of the Mississippi River. Kind of paints a picture of what our community looks like, the landscape and the surrounding area. We are on the banks of the Mississippi, and our hospital is about a mile away from the Mississippi River in west central Illinois. We serve the Blessing Health System. We serve a tri-state area, southeast Iowa, northeast Missouri, and west central Illinois. We are the biggest health system in a 100-mile radius with about 150,000 in our market share. But we are a community of 40,000 actually in Quincy, Illinois. Kind of a unique demographic in our area. We do have a significant partnership with the BJC Collaborative, which recently occurred with our regional players in the health market in west central Illinois and the surrounding area. So we partner looking at best practices around us, continuing to grow for our community and the community we serve. I really enjoy this photo because it tells you a little bit about what the area and the landscape around our hospital looks like, but we are constantly going through growth right now. So we currently have 3,000 employees, and we continue to see growth opportunities for our health system in the market. We have a provider clinic that are part of our health system. We also have a College of Nursing continuing to bring nursing resources to our community and growing that. We also have a sister hospital, Illini Community Hospital, which is a critical access hospital in Pike County, Illinois. Continuing to stay in connection with our community and where we serve. We do have a lot of manufacturing in our regional area. We also have a lot of agriculture in our regional area. So it definitely brings a presence to Blessing, the patients that we serve, and some of the artwork that we're going to talk about in our addition. Part of this project was investing in a $70 million inpatient tower for our health system. It's a huge investment in a small community. It significantly brought the biggest healthcare investment in our hospital since 1970. So perspective of 40,000, a community of 40,000, we serve 100,000, and we just invested $70 million in a community. It's a significant impact to our community as a whole and to our healthcare in the region. Blessing Hospital started in 1875 as a charitable organization. The old saying is that we were a blessing to the community when Blessing was formed. The picture on the left features our original building and our original cornerstone, which we still have today, and the small group of nurses and volunteers that served patients. So unique in our community, a very rich history. At the time of our project, we did invest in a museum wall in partnership with our consultants. And you see this museum wall, which features the history of our region, the history of healthcare in the U.S., and how it was growing and evolving in our community and for our health system. Very, very sacred in our community, but I think it just speaks to the history of what we're going to talk about in fine arts here in the community in Quincy, Illinois, and also the evolution of healthcare for Blessing Health System. We are specifically a Blessing Hospital, an acute care hospital, serving, we have 307 licensed beds. On this project that we're featuring, we did impact 92 of those licensed beds, so significant impact on our inpatient care, significant improvement. Focusing, about half of the project was focused on our mental health services, bringing in inpatient service. In our region, we're one of the larger mental health inpatient care facilities in our region. There's a significant need all over the central Illinois and the markets. We have patients that come from quite a few miles away seeking mental health services. We also did feature 52 licensed beds for medical surgical improvement to our hospital. I'll hand it over to Robin.
Great. I'll just come down here where it's a little bit. So early on, we wanted to talk a little bit about historically, Blessing Hospital has used artwork in projects for quite a while. Beginning in about 2003, we started using the work of Henry Domke, a landscape photographer who had previously been a physician in a previous career. And he's written a book on including art in healthcare. A lot of his pieces form the basis of the art in the Cancer Center and the ER edition that was done. Those were some of his first installations. The other, as we went along, they have used art in this is the linear accelerator area, and then the patient recovery, prep and recovery area for cardiac cath and the EP lab. This is just a couple of shots of the Moorman Pavilion. The Moorman family's been in the Quincy for a long time and made major donations for making this project happen. It's about 173,000 square feet and $69 million for the total project costs. A little detail on the building itself. There's a portion of the building that was designed and constructed to add on to the existing patient tower here. So there's new elevators at that end, which gives them a lot of flexibility in the future to be able to switch ends of the units with their access for the provision of health care from that end, as well as the opportunity for additions on the new piece. There's 32 beds per floor, 52 total rooms. Additionally, there's 3 behavioral health units, a total of 41 beds. There's also expansion of the College of Nursing, a couple of classrooms, a small infusion center, and expansion of the dining room. So I guess there's a lot of healthcare facilities folks here tonight. I guess, anyway, you're very familiar, I'm sure, with how long these projects can take. This project started in 2001 with a master planning studies and was first identifying the need for this. This went on with a couple of other studies that followed upon that. Then there was some programming around 2008, followed by design documentation. It was on and off again for about 4 years. And during that time, we actually constructed numerous prototypes, explored lots of different design options. And finally, the construction was begun around 2012 and finished just last year. Okay, I'm a cyclist, so I want to switch gears a little bit here. So you've probably been to a number of sessions that have been talking about the patient experience throughout this conference. One of the things that we paid attention to here was what's the patient experience as an inpatient? And a lot of times this can be an overwhelming experience when you get to your room. You've probably gone through all kinds of things. You've transformed from being an engineer or whatever your role is into a patient. And suddenly, you shed your street clothes and you're in a patient gown and you've got this new environment that you're having to occupy, and the whole focus is about your health. And there's a lot of anxiety, probably that you're feeling just from the nature of being admitted into the hospital. So it can be a little overwhelming. And it can also be kind of scary. What are these things that are going on in the room here? That we're installing patient lifts to help with falls and help with staff, but it can be real stressful too. So what we look to do is try to create an environment that is going to help with all those aspects and make it a little more calming. The users in this case actually challenged us to use artwork in this way because of a study that was done by Roger Ehrlich in 1984 showed that the use of art in this environment could help reduce stress. And it also provides a positive distraction for patients. A later study showed that there were improved HCAP scores. And they found that there is some improvement, but it's too early really to tell. The numbers are just coming in, and there's sort of a factor at the beginning of all this when you don't know if it's because it's just a new space or this is truly happening because of the space. Also in that study, it was determined that there's a preference for nature images in art, and as opposed to chaotic abstract art. So when we first started looking at this, we talked about what the focus of the art budget should be. And with us, the focus centered around trying to put most of the money in a place where the patients would be the most, and that is the patient room. So we shifted a lot of the funds and everything to the budget to really go for the art in the patient rooms. Previously, we'd looked at framed and matted artwork, but in this case, we thought, well, if we actually put the art on the back of glass panels, instead of paying for matting and framing, we can actually afford to buy a larger image, and it's a cleaner way of presenting the art in the space, and you're not spending money on the frame. So we took a look at that, and then at the very beginning of the process, we explored lots of different plans, opportunities for how we would actually structure the room. We actually built a paper mock-up at that point. This is just the beginning. There were tours of other facilities as well at this time. And at that time, we began to look at locations for art. So you see this light here that we had in an early paper mock-up migrates to another location. It comes to the center of the room here. And this is a little bit further down in the process. When we got to a comfortable place with the client, the staff, and the users, they built a patient prototype room. And this is a room that was built within the existing 1970 tower. They actually utilized it with patients, so they could get some real information from patients and see what they liked and didn't like about the room. So we mocked up the head wall. I mean, everything is a real working room here. Previous to that, we actually did mock up the head wall in another location. And it was decided at that point that we would look at putting an art panel in this location. Also, after that had been in operation for about 6 months or so, comments were collected from the patients as well as from the staff and the healthcare providers. And then we summarized all of those into the comments and tried to look at this is within the geometry of the existing building. So we looked at tweaking this in such a way as much as we possibly could within the parameters of that space to change the room. And then the room was rebuilt, and we raised the ceiling. We did a number of things to try to include those comments. And once it was rebuilt, then comments were again collected after it had been in use for a while. We did things like it was determined that this horizontal rail needed to be 2 inches taller. So that made the geometry of this panel, the proportions of it changed. And then there were a lot of other aspects of the room that we were informed about. But all of that had to come together. And that's what I mean by the integration of the art into the process. We also looked at the footwall and changes that happened there. Early on, we looked at the idea of the glass panels, maybe just forming a band with a TV. And we needed a marker board that would, maybe it would reside in this location. We looked at the idea of putting the image across the entire panel, if you will, on the footwall. And then this was a pre-printed marker board panel, but it was decided that really should be interchangeable. So, I mean, even we heard a few good ideas that came up in some of the other planning sessions about, maybe including the nickname of the patient in that space. So there's a lot of things that come up on these, and it's a great idea to be able to change those up. So when we looked at the option here, this is another footwall where we include the TV and the marker board, again with the image here. We shifted, because of the use of that room, we had previously had a desk. The user said, oh, no, and the patients thought, well, we better use that space if this was a bench. So we changed this out to become a bench here. And what that did, we were able to simplify dramatically what we were doing with that art. Because previously we had a whole array of different panels, cut out for the TV bracket, all kinds of things that really were affecting the price. This version, while the image is bigger, was actually about half the price of what we were getting from the other design. Other pieces that came into play here were the movable trash and linen carts, that they like to be able to pull these out and be able to use them. They help establish the depth of this counter, as well as this wardrobe that's designed to have an extra folding chair in it for visitors. There's a lot of things that went into just getting this perfectly balanced and usable. After we had so we had the head wall geometry and the size of that, we had the foot wall geometry, then we began to take a look at the actual selections of the art. And so we worked with an art selection committee of senior leadership. The criteria used was a nature art, high-resolution images, and we wanted imagery that was from the local environment. So it was very regional, that we didn't have a lot of things from other parts of the country. And this is part of the selection process. We identified those locations in the single rooms with a foot wall, head wall location, and then a flex room that had it above each of the beds and then on the foot wall there. This is the floor plan that shows the 32 beds per floor with 6 flex rooms. And then we started to take a look at what the art was actually going to be. We went through, we had numerous images. This is all Henry Domke's work, so that sort of simplified things. We did look at some other artists, but things were getting pretty complicated, and this seemed to pull it together in a way that simplified things quite a bit. Here we actually then have a foot wall image, and then the head wall image, we tried to use something that was very similar or a detail from the foot wall, so that there's a tie-in between your foot wall image and the head wall image. They are actually companion pieces, and they work together. So we have a number of options. We began to look at these pieces. We also looked at scenes that were different times of the year. So we have some autumn scenes, some spring and summer scenes, so that we have a variety in that aspect as well. And we tried to stay, as I was saying before, just regional art. When we get to the flex room, we have 2 images so there's one over each of the beds. But again, it's all related. Few more shots. Here's our private room early on, and then the flex room. Once we had all that selected, then we got submittals, and I don't want to get down in the weeds too much here, but what we looked at, the images, pretty high resolution, but we would go in and capture the proportion, this was the head wall proportion here, of what we wanted for our selection. Then we had a 24 by 24 inch paper, high-resolution paper copies made, and those were submitted to us for our review with the hospital. And finally, we got an 8x8 sample of what it would actually look like on glass. So we had just a piece of what we would be seeing and understand that. These are some of the installations then after submittals were approved. These are just some shots that were taken during construction. And finally, we get to a completed room where we have again the hampers, the marker board, and there's some actual drawers that were installed beneath the bench for additional storage. This is showing the foot wall in a broader context of the space. So we have the bathroom that's right here. There's lift rails in all the patient rooms. And then the family area over to the left with the actual window here. And then this is the head wall image We included vertical rails that came out of some of the surveys with the users, as well as a horizontal rail, and then the patient family areas in the back. So this is just a summary of our budget, actual costs that we had for this portion of the project. We said we had $128,000 for the glass panels, and then $24,000 for the installation, for a total of $152,000 for all the rooms and all the art. There's basically 22 different images repeated. Some of them are repeated. So with that, I'd like to turn it over to Priscilla so we can talk about the public areas, unless there's anyone that has any questions that you'd like to throw out about this part, or we can catch it up later.
How did you balance on the wall?
So on the wall, there's actually here, we identified here, there's a channel. So it's sort of like your bathroom mirror has a channel on the public bathrooms, channel top and bottom, and it's just slid in, drop down. So it's very simple kind of mounting on that. And then the head wall is included in some extrusions within the head wall system. Yes?
You chose the donkey images, as have most hospitals that I'm aware of, including my own. But I feel that it's kind of corporate at this point in time. Corporate art. Have you thought about using local artists?
Well, that's a very good question.
Great segue.
That's really a great segue into Priscilla's piece. This is just the art for the patient rooms itself. So there's quite a bit that we did to do exactly that. We did consider some other artists for the head wall. This is all done with Skyline. Henry has an exclusive arrangement, as you probably know, with them. And the others were a little bit problematic. Some of the artists the photographer we worked with was a little bit more of a challenge. This really simplified it quite a bit.
Just another highlight on Henry Domke. His first installation of artwork in a hospital was at Blessing Hospital. He did get one of his first installations. So we have a history with Henry as well. So it's a little bit of a tradition with Henry in our hospital.
So, excellent question. We were lucky enough to come in to do the art everywhere else in this pavilion. A great honor. And I think what I would like to go through is how we come up with selecting artwork for a hospital, and this one in particular. So I'm going to take a step back and go through a little bit of evidence-based design theory and talk about some of our justifications for selecting the artwork that we do, also based on geographic location and the purpose and what we call the personality of the facility. So going back to geographic location, we were terribly lucky on this one. Not sure if you guys have been to Quincy, Illinois, but it's a stunningly beautiful part of Illinois, right across the Mississippi River from Missouri. Very rural farmland in certain areas, gorgeous water, beautiful historic downtown. We got lucky. So our motto at our company, where we select artwork, is we don't want to put snow-covered mountains in Florida. So we do want to honor geographic location. We want to honor the fact that the patients in your hospital, the patient's family, and in fact, the staff of the hospital actually live there. So we want to, again, pull that geography into the project. So evidence-based design, I could talk forever about this. This is really spearheaded by the Center for Health Design. And that word evidence is a big one. So my history in medicine would dictate that evidence is fact. And when you step into the art world, it gets a little bit dicey when people talk about evidence. So I really wanted to address this. The definition that's most commonly used of evidence-based design is it's the process of basing decisions about the built environment on credible research to achieve the best possible outcomes. And I'll come back to that because I love that best possible outcomes. So research, there is evidence, fact-based research on a lot in architecture in healthcare. Single patient rooms, they reduce infection. Location of a hand sanitizer can reduce infection. Proper lighting at a pharmacy dispensing area reduces prescription errors. A patient bed lift reduces staff injury and patient falls. Those are fact, evidence-based design. The design showed an improvement in the outcome, in patient outcome. So where does art come into that? I like to say my purple may not be your purple. My favorite art that hangs in my living room may not be what my client asked for. So I go back to what Robin referred to is this sort of now what I classify as an infamous study by Roger Ulrich in 1984. And it's titled "View Through a Window May Influence Recovery from Surgery." So forgive me if you guys have read it because a lot of people talk about this. But this is a study that is pretty infamous because what he did is he took people who were being operated on for the same problem, gallbladder surgery, and he divided the group into half. And half of the post-op patients recovered in a patient room with a view of a brick wall. And the other half recovered with a view of nature. And his evidence, his outcome of this study showed that the patients who viewed nature out their window complained less to the nursing staff, actually used less pain medication, and were discharged from the hospital up to a day and a half earlier than the patients who viewed a brick wall. And this really was what I would classify as sort of the first study that linked a connection, made a connection between a view of nature and patient outcome. So I think the art world kind of took it from there. I think a view of a brick wall is more common, particularly in urban environments. And so I think pulling appropriate selections of artwork into a hospital becomes really integral. Evidence-based design is really sort of about that predisposition, our genetic predisposition for biophilia, our love of nature. And it really, a lot of studies are out there, even in artwork, that show images of nature reduce anxiety. They create a much more soothing environment. And I think that innate love of nature dictates, either whether it's conscious or subconscious, kind of dictates our state of mind. And any of us who've been in medicine know that your state of mind, particularly as a patient, is really directly linked to positive outcomes. So where do we start in this particular project? So what's important to us is that clearly we're looking for a specific type of art. We're not looking for abstract art. We can discuss that another time. Some people consider that sort of controversial, but we really are looking for nature-based imagery. So for Blessing Hospital, we were also not only lucky on geographic location, but it was a very, very artistic community. And so we do look in the community for people who are artists. So we were lucky enough that there is a fair every summer, an arts fair in Quincy, Illinois, and we look through that list. And we also look through a lot of other areas. Quincy, but surrounding areas of Illinois, and certainly pulled from Missouri as well. Again, black and white may not be sort of a thing that we believe in, but this image came up, and it actually literally is called Old Men in the Park, Quincy. And this was indeed taken in downtown Quincy, Illinois. And this artist comes from Blandonsville, Illinois. So it's images like this that we start to look at, that indeed you can't carpet a hospital in landscape photography. So we want to sort of add variety, but we want to add variety in many different ways. So whether that's photography or the diversity of the artists that we actually selected, or the images and how appropriate they are for the diversity of location as well. What's appropriate for the location where we're placing this. This is Liz Solaro. She actually lives in Quincy, Illinois. She's an artist, and she happens to actually own an art gallery in Quincy, Illinois. It was a great place to start. So she takes a lot of photographs of the surrounding area based on the Mississippi River, the farmland. But going back to this, these are macro nature images, so close-up images. She took of butterfly wings. And these we ended up placing in the cafeteria. These images were placed as, well, we'll get to that in a minute, as our elevator lobbies. This artist that we found, Ann Miller-Titus, she's a textile artist. She's a self-proclaimed obsessed with maps. And this was really quite a remarkable story. This quilt that I found that Ann did is actually literally a map of Quincy, Illinois. And at the time that we were looking for artwork, I found Ann, and this was still available, and the story gets even better from there. When she found out that the art committee at Blessing Hospital was considering purchasing this quilt, she told the story that she was treated for cancer at Blessing Hospital very successfully, but while she was being treated for cancer at Blessing, she actually created this quilt. So this is one of the number one reasons we look in the community for artists, that connection that they make, that the Blessing Hospital is part of the Quincy, Illinois community, but so much so that the Quincy, Illinois community is part of the hospital. That's for every hospital we've ever worked in, that integral connection. Not only was this a very meaningful work of art that ended up going in oncology area, but also it was so important to her that they were interested in purchasing it that Ann actually found a donor so that the hospital didn't have to pay for it. This is why I do what I do. This is an artist who's local to St. Louis. But again, this is this kind of biophilia, very bright, clear images of nature. This is an artist local to St. Louis also, Bert Remus. Again, bright, beautiful, glowing images of nature. And again, Henry Domke. It was pointed out a lot of people use Henry, but it was particularly pertinent for this project to continue using him. Larry Camphor, who's out of Champaign, Illinois. And again, diversity of images based on location, but also based on media. Well, we didn't just do photography, we did some paintings. We wanted to pull in images of actually Quincy, Illinois, one of their bridges. And then each piece that we selected was, again, based on location. So whether it was the waiting room, a nurse's station, the lobby. Again, going back to variety, we looked at some textile artists, we looked at some ceramic artists, we did some glass feature pieces. This was at the reception area, was a mix of acrylics and canvas, but again, I selected this based on sort of its reference to water imagery in the Mississippi River. And again, going back to the cafeteria that we selected, Liz, who's local, to create these beautiful macro nature butterfly wings, the infusion area. And then great fun for us is wayfinding. And so we selected artists that were local to use giant files to blow up for the entire wall so that each elevator lobby on each floor is an entire wall image, vinyl wall covering of an image that we thought was very reflective of the area. And for each one of these, each floor, if we selected something that looked sort of bucolic and rural, we tried to pull that kind of theme throughout the floor so that when you went down the hallway or to a waiting room, there were other images that were reflective of that theme. Again, same here. That's Liz Solaro's again, and the one in the middle, the blue bridge, that's from Quincy, but also another artist from Quincy, Stephen Kulo. And again, on this floor, there's a water-based kind of theme that we pulled throughout. And art as wayfinding is really the fun stuff also. It's clear when you get off on floor 2 where you are. You won't forget when you're on floor 3, that's not where I want to go. It's clear that it's different. And this was done by the signage company. Each one of these patient room signs reflects the pieces from Henry Domke that are inside the patient room as well. So this is the budget that we worked with. This is a piece from Abby Ganju. She's up in near Chicago in Illinois. As I referred to earlier, it's not a line item thing. We just take a budget and we honor the budget and try to mix up the variety of artists that we pull into the project, honor the community, and vary the different types of art that we include to make an art collection that really reflects the personality and the geographic area of each project that we do. And this one in particular was just a great joy, a really artistic community, and a very invested hospital that really cared deeply about what went in there. And it shows. So that's my big thing. Art matters. It matters what you put on your wall. Good? Any questions? Yeah? It's a great question. I think it's sort of in the future. Our company did a hospital project in Arkansas where for each local artist we did signage with a QR code, and we developed a website that allowed each artist and their location and their bios and their own personal websites to be featured, and that's a possibility for this project as well. So it's an important story, but as you know, Jayne can speak to it more than I. We were discussing this actually last night, that a lot of people in the community know each other, and it's clear that as they come into the hospital, Jayne can speak to this better than I, that people recognize the artists that were used.
She talked a lot about Liz Solaro, who had the butterfly wings, and Liz is actually a spouse to one of our physicians. So Dr. Solaro treats patients, so we have a community of artists, and it just becomes integral that everyone knows that story and hears about it and talks about it. So it becomes very integrative into our culture and the community as well.
Yeah.
You mentioned evidence-based design. Any pushback from finance and folks about this budget and how?
Yes, no. I think the important thing to see is that art is really, when you're picking furniture and equipment and you're at the tail end of the project, that's when you're finalizing the art. And so the project always had a budget and a line item for it. And so really, as a team in facilities, we held the line for that. I think that any aspect, whether it's art or critical equipment, can get pushed out if you're not managing the budget as a whole. So one of the things I think we did was keep our leadership engaged and informed so that they saw value in that. And when it came time to move patients in, it was a lot of discussion about the built environment and the art and seeing the community inside our space. I like to talk a little bit about that old men in the park. In our community, that image and the 3 guys on the bench, that could be any of our family members. We connect with that. That's the exact same spot. So people come in our hospital and think about their family members, and those things just feel natural. So early buy-in and maintaining the budget was key for us. Yes?
You talked about the patient rooms and the work that went in to figure out how the artwork was going to be reserved, I guess, on spaces on the wall. Was there a similar activity to very carefully designate, this is an artwork space, don't put, light switches on the wall and signs and things like that?
Right. We tried to do that early on. There were some that kind of missed areas, but also opportunities came up during construction. But for the most part, we were pretty lucky in the way a lot of that happened for the way we designed it. We tried to keep that in mind as the documents were being done as well. I remember walking through the space one day and saying, "Oh, there's a strobe. That's not supposed to be there," And so, but oh yeah, well, it's there because it was close, and the design intent was. So anyway, we got that moved, and I think that we could pay better attention to that in the future. We may want to just totally outline shade those walls, and nothing goes in here.
It's a great question because in a lot of healthcare facilities, there's an awful lot of stuff on the wall. And it is always sort of our installation nightmare where you're like, well, there is literally a strobe in the middle of the wall where the vinyl wall covering is going. How did that happen? But, it's integrative. It does help hugely to be included as the artwork people at the beginning to try to avoid that. We have a much more common problem with it when we come in at the end. But we can always work around stuff. But clearly, if it's incorporated in the beginning, things work out a lot better.
There was one piece that showed earlier that was a waiting room space that there were a lot of switches. We didn't realize where and how that was going to occur. So we made accommodations, and the proportion of the art may have changed just a little, but there wasn't any other place to go with the switches with all the glass and other things going on, so sometimes you have to make accommodation as well. One thing we tried to do at the beginning of this was to reserve some of the construction budget for the patient room for this, so some money could be held there as in addition to the FF&E items, so sort of below the construction cost. So I think that helped some. Yeah.
How did you guys work with the interior design team to make sure that there was ownership by that team as well as guidance?
They were very integral to the process. Our interior designer was actively involved in all of this as we moved ahead, and the actual art in the patient rooms. I think there's 5 different accent colors, paint colors, and she mixed those up with some of the art too. So even though the art may repeat, it has a different accent color on the wall and looks a little different in one room versus another. So we got a lot of variety out of that as well. But she was actively involved in what we, as well as our graphic designer, helping us with the resolution. Whether this image could be blown up to that size and still be legible and look right. So there was a lot of collaboration that went on there.
And we had to also integrate our sign vendor as well. So you saw the sign products. That was the first time that vendor had even integrated artwork into signage. So when you get all these stumbling blocks of finding space on the wall, we started early. We weren't thinking of artwork at the last 2 months of completing the project. So just a lot of collaboration and planning early on.
And even the prototype room, when I was talking about the proportions, we had large paper copies made to try out a few times there without spending a lot of money on the art, but at least try some sizes and shapes, and those were shared with senior leadership, or we had them up for a couple of days or something when we could, folks to check them out. Yeah, this was really a slow track process, as you can see from that schedule. And we did prototype rooms, we had mock-ups, a lot of choices and opportunities to make choices and decisions with the senior leadership as well. Yeah, you had a question?
So you did vinyl on like the walls, the big walls, and then glass in the patient rooms?
Correct.
Do you think there's any reason why you couldn't have put vinyl in the patient rooms?
We looked at that, but the glass, I think, it's very easy to clean. They've got alcohol wipes everywhere. If you need to wipe it a little bit, you can do that. It's also an area that I think could, may receive, you can get up and touch it more. I think it was less of an issue out in the elevator lobbies, I think.
For sure. It's also a really different look. I mean, really, if you're standing in front of it, the ones that are on glass, they almost virtually glow. I mean, we were just discussing it with some of these photographs, is that it almost looks, some of them, like they're backlit, and they're not, and you will not get that effect on a vinyl wall covering. So it is really different. And, going back to evidence-based design in healthcare, one of the other definitions of evidence-based design in artwork is that this is for patients, families, and staff. But that there's a reason patients come first, and so the patient rooms is clearly where the patient's going to spend the most time, and so I think that's really where the focus was for as far as artwork budget goes.
We also had a discussion a little bit about glass, and when you occupy a new building, all the clinical leaders move in, the temptation to hang things on the wall and to hang and modify the space is significant. And I think there is a trend we're seeing that when it's a piece of art or a piece of glass, people do not want to hang that graffiti, like the keynote speaker mentioned, onto that. I haven't been in a patient room and seen a notice on the art, and I'm not seeing it in any of the framed matte art also. So I think there's something distinctive about that effect, and teaching all of us to respect the patient environment together.
The final walk covering the elevator lobbies, was there any discussion that I know some of my hospital clients wanting wall protection everywhere?
Yes, sure.
Yes. So the way these elevators work, the elevators on that side are people elevators. They're not. So there's other elevators that are the staff and cart. So the real distinction is that there are no carts coming off of those elevators. They come off of the larger elevators on the service side, as well as patients being transported in stretchers. So we did have some discussions about that, whether we wanted to do a crash rail or something there, and it was decided that this would work.
And we're not seeing, the building's been open about a year, we're not seeing significant damage to the artwork, but I do think it does create an environment where people are very curious about it, but they don't want to touch it too much so far. So that's just been an interesting kind of effect. Thank you so much for coming to see our presentation. If you have any questions, feel free. Our information is at the end of the presentation.
Great. Thank you.